Let's react to David DiMuzio's video on 10 reasons to not get a hair transplant.
The number one reason, and not necessarily the most important, but let's start here, why you should not get a hair transplant is if you are not willing to wear your hair longer in the back to cover scarring. Because it doesn't matter what kind of hair transplant you get, you are going to have some scarring.
So you're definitely right that regardless of whether you're getting FUT or FUE surgery, there will be some scars on the back of your head. But FUE scarring, when performed well and with the right tools, is very difficult to detect, especially if you've just had like one surgery of a couple thousand grafts. We'll show some pictures of the back of people's heads after some FUE surgery in my practice. And you know, many of my male patients wear their hair incredibly short in the back post-op, especially because they want to show off their results on the top of their heads, right? So they'll wear this shorter and they'll fade into longer hair. And most of them are very comfortable wearing the back short because it's difficult to detect these little tiny dot scars. I wouldn't say that it's the same type of appearance when you've had a strip and you have that long line that even if it heals well, it still looks like a linear line scar versus the tiny small dots. Now, FUE can be done in a way that gets you very poor scarring, but it can also be done in a nice way so that it overall looks like not much happened, especially after a single surgery.
If your donor hair is thin, fine, and weak, it's probably in your best interest to wait until it's stronger before you have a hair transplant.
Yeah, I think number two is another really good point, that it's not even just the donor hair, but it's the hair around the recipient area as well. You want the hair in general to be in the strongest condition possible. And that's why, you know, medical therapy plays a big role with hair transplant surgery. So things like minoxidil, finasteride, low-level laser light, PRP, microneedling, all those are relevant in the right scenario because you want the hair to be super strong going into surgery.
The problem with the industry sometimes is pushing people into surgery. You know, it doesn't mean that someone with thin, fine, weak hair.
I think a good question to ask your hair transplant surgeon is, how often do you tell patients that they're not a good candidate? I actually never get asked that specific question, but if the answer is, oh, I never say that, you know, then you probably don't want to go to that surgeon, because many patients are not good candidates, especially not right when they have a consultation with me. They might become good candidates if they stabilize their hair loss, but they're not always good candidates when we first meet. And so being able to say no and knowing, you know, when to do that is an important skill set, and it's one that has to stem from not being overly greedy, right? So I think this gentleman is right about that.
It's probably better for that person to get on a preventative treatment and try to make that hair a little thicker, stronger, and fuller. It's in their best interest. I mean, it all comes down to the donor hair.
100%.
If your donor hair is thin, fine, and weak, guess what? Your hair transplant.
It's not just about the donor hair, it's the hair also at the recipient area. That's very important, because if I'm building on a foundation of some really solid density, then the results are just going to be that much more impressive once we do the transplant.
Number three, if you're in your 20s, you already have hair loss and you have hair loss history in your family, and someone is recommending that you get FUE surgery, get a second opinion.
So again, this is complicated, right? This is very nuanced. All these points are very nuanced. So classically, right, like what we're taught and in our textbooks, if someone comes in, 20-year-old man, and you know, he wants surgery for his hair, you should just say, no, it's not the right time, you should wait. That's not always true, right? So some people at 20 are already Norwood 5, 6, 7, and may have started losing their hair at the age of 16 or 15. And so the answer for a patient like that shouldn't be, oh, just continue to wait. What are they waiting for? For them to continue to be a Norwood 7 for the next 80 years? That's not a really good answer. So you really have to take it case by case. Now, there of course are younger men who come in and, you know, they want their hairline lowered and they want this incredible density and they want to look like they did when they were 16. That's maybe not the best candidate, right? But someone who's had enough hair loss and who's willing to be on medical therapy and has been on it and has shown stability should be offered a surgery.
Number four, you have dark hair on light skin and are told you will be able to achieve the results you want in one procedure. get a second opinion.
Regardless of hair color, some patients still look for additional grafting later on. So they still might come back wanting a second surgery or a third surgery. So I always tell all of my patients that that might be an option. That might be something that they come back with and ask for. And that's okay. That doesn't mean that the first surgery failed. It's very easy to tell if the first surgery didn't help at all or if it helped and then they just want a bit more. So I don't find that the hair color necessarily matters there. It's usually the size of the area that we've worked on and the number of grafts that we had. But remember, results may vary, right? Because if I transplant 2,000 grafts for a patient with very fine caliber hair versus someone who has very kind of thick caliber hair, the person with the thicker hair, of course, is going to have a more impressive result with the same number of grafts. And that's something that we often don't discuss.
Number 5, you are told by an FUT only doctor that you need FUT. Or you're told by an FUE only doctor that you need FUE. Get a second opinion from a board certified surgeon that does both.
I agree with them here. I think there's always a tendency with most clinics and most doctors in general to not give patients like the full range of options, especially if they don't offer some of those options, right? That's just maybe human nature, I don't know. But if there's something that I don't do that I know someone else, maybe not even in the city, but maybe just around the world does, and I think that for that specific individual, they can benefit from that type of other treatment, I will surely send them to whatever other place offers it. I think that just comes down to just general kind of ethics and morals and just trying to do the right thing for the patient, even if that means losing business. I think that's what it comes down to, right? So that's one element of this. The other one is that, as FUE has become so popular, many hair surgeons are not even being trained in FUT technique. And that's kind of sad, and that's a problem because sometimes FUT can be a great modality to use, a great harvesting technique. So I agree with them that you definitely want to pick someone who at least has the ability to do both, but they might recommend one or the other for your specific case.
Number 6, if you are considering getting a hair transplant from a dermatologist, cosmetic surgeon, or doctor who has purchased a hair transplant machine to do your hair transplant, run fast. Do not get a hair transplant.
Yeah, I think this is a really good point that you have lots of people, lots of doctors that offer these types of cosmetic procedures, right? Hair transplants, they're offering Botox, fillers, they're offering other types of cosmetic surgeries without the proper training. So regardless of what, degree you have or which specific board you're, a part of, I think it's most important to just seek out the proper training to be able to offer hair transplant surgery. So I think from a patient's perspective, you need to know the person's pedigree, right? I think pedigree definitely matters. It took me time to figure out how do you do this stuff, You need to be associated with a solid mentor who has experience in the field to truly understand it and to be able to offer a wide range of services to patients, right? So I definitely understand where they're going with this, but I think it's also important to keep in mind that you want someone who's artistically sound and who's surgically sound. So some doctors have a more robust surgical background than others, right? Like a general surgeon or a head and neck surgeon is going to have more of a surgical experience than a dermatologist. Does that mean a dermatologist can't do FUT? Of course not. But, there's going to be some nuances there. And then there's like artistic elements, right? Someone who maybe went into dermatology or, plastic surgery or facial plastic surgery, they probably have a little bit more of an artistic acumen. And when they design your hairline, hopefully they're taking that ability and applying it to your head, right? So that is something more nuanced than I think what they're talking about here. But I think this is a great, number 6 here is a great starting point.
Bottom line is that there's not a lot of dedicated only hair doctors that are specialists. Buying a machine, even though you have a medical license and you're a plastic surgeon, does not make you a hair transplant doctor. Period.
Agreed. Yeah, no, that's a great point. Yeah, and you need to be doing hair all the time, right? So it is possible to combine hair with a few other things, but as long as every day you can do a hair case, for example, or at least 3 times a week. If you're doing a hair surgery once a month, once every few months, that's not enough to really get good at it.
Number 7, if you are a bona fide FUE candidate, make sure that the surgeon doing your FUE hair transplant is the one who is actually extracting each one of the grafts. That is, it is the surgeon doing the surgery.
Look, I think at a minimum, your surgeon needs to be able to extract. So if push came to shove and the rest of the team was not there that day, or someone had to leave or got sick, you need to make sure that your surgeon knows how to do the extractions. Many surgeons don't, right? So I think that is critical. This gets into kind of a complicated discussion. You know, most hair clinics, even super established, you know, well-known clinics, including my own, I'm not always the one extracting the grafts, right? And so the question comes up, is that right? You know, should it be different? Should I be? I used to do all my own extractions. I can jump in. I still do occasionally, you know, do the extractions. I have a team that, like a full-time team, including a PA, and my PA will often be the one to do the extractions. And having a certified PA is legal for them to do the extractions, assuming they've been taught properly, they understand the technique, they're doing it, you know, day in and day out, and as long as it's under the supervision of the surgeon, then it's okay. Now, most people don't have a dedicated hair PA. I think there are about 50 of them now in the country. So just keep that in mind, right? So, you know, for me, it allows for me to be overall more efficient as a practice, to not have to be there doing extractions. It also allows me to be hyper focused and at my A game when it comes to doing the site making. I find that the site making is truly what sets your blueprint and creates the sort of artistic result. And that's what I want to be the freshest for. But it is true that in FUE, whether you're here or in Turkey or anywhere else, oftentimes the doctors are not too involved. Not at all, like in any part of the surgery. And that I think is problematic.
Number 8. If you don't have a plan, then don't get a hair transplant.
I love the idea of having a plan. I think strategy is super important when it comes to surgery, including hair transplant surgery, and having a good plan, especially like if you know that the person has multiple areas of loss to begin with, making sure they have enough donor to supply multiple areas before you take them on for even their first surgery. So I think this is 100% right.
Number 9. If it seems too good to be true, it probably is.
Yeah, there's a lot of fraudulent activity out there, stealing people's before and after pictures, you know, not having the doctor at all in like the facility when the surgery is going on, you know, and who knows where they might be all day. Lots of questionable activity. You know, anytime you see a price that looks too good to be true or some heavy discount, there's a reason for that usually. And so lots of factors here, but I think that, you know, this is true, what they're saying.
To the point is that we're kind of recapping and talking about hair transplantation and being 50% science, 50% art. Let's start with the artistry. The artistry all comes down to you seeing that doctor, talking to your doctor, and having multiple videos and photos of before and after of patients that are similar to yourself. You want to see.
Yeah, I agree. I think artistry is a huge part of this, right? So I made a video not too long ago about how to fix a receding hairline, and I get into the actual specifics of what leads to a natural looking hairline, and a lot of it is fairly artistic on how to see it, right? You have to see where the hairline ought to be and how it will blend in with the surrounding hair and all those different elements. So it is very artistic.
And number 10, and I think this is really important, having been a hair transplant patient and spent thousands and thousands of dollars on hair transplants, is that scar. Does the doctor guarantee their work? And are they willing to fix that scar if they leave you with one that is bigger than you're comfortable with?
Not a fan of that statement, because, you know, this is surgery, right? We're not building like, I don't know, automobile here or like a chair where you can guarantee that the chair, you know, is free of any broken pieces when on arrival or whatever. But, you know, this is like a human being. There's lots of factors involved with healing, and nothing can be guaranteed. You know, if he's talking about guarantee from the perspective of, you know, for free the surgeon will go in and adjust the scar, that's something else, but that's not guaranteeing that the scar won't be a problem, you know. And the whole idea of guaranteeing that they'll go and repair, who knows, even if they go in for free to repair, if it's going to be any better. The scar could be bigger than you're comfortable with. That's the risk you take when you get the surgery. You're signing up for surgery, you're signing up for the risks in addition to the potential benefits. And that goes for wherever you decide to go, that goes for whichever clinic you choose and whichever surgeon does your actual transplant. You can't control the exact scar that you get, whether it's FUE, FUT. You can give people an idea, this is my prior work, this is what I hope you'll get, but you don't actually know exactly what that patient will get. So you can't guarantee it, right? And if someone is too scared of the scar, then they shouldn't do the surgery. They shouldn't get it done. That's my thought. If you're looking for a guarantee of you will get some regrowth of hair, then sure, I think that's a fair, ask of a hair transplant surgeon, is that there's going to be hair growing. But what if you happen to have an underlying inflammatory condition that maybe springs up, during the recovery process, and you have trouble kind of growing out your hair, you do a biopsy and it turns out you have active inflammation, you have an actual, medical underlying condition. Or let's say I had a hair transplant when I was younger, which I did not, but let's say I did, and then I developed alopecia areata, which I ended up, developing, as you guys hopefully know by now, right? So what am I supposed to go back to my hair transplant surgeon and blame them for not giving me a result because it was guaranteed, because I happened to get an autoimmune condition? So that's where I think some of this falls apart. Look, I think being there for your patient and for the patient to know that you're not going to abandon them, and you're not necessarily going to, if they have a true complication, you're going to be there for them, and you're going to work with them, and you're going to make all the finances work for them. I think that's fair. If that's what he means by the guarantee, then that's fair. But expecting perfection, expecting that anything that the patient's unhappy with is going to be corrected. If I do a surgery on someone who's totally bald in the front, we do 2,500 grafts, they have more hair, but now they still see some light shining through and they want another surgery. Am I supposed to do that for free? No, they need another surgery. We're going to be transplanting a similar number of grafts, and they're going to be having to, pay for it again because the first surgery worked, and now we're doing another one to bump up the density. But again, I think it's explaining these things in advance so people aren't shocked when they see, their result, and when they think that maybe they want another surgery and they didn't budget for it. So now they're upset because they didn't budget for it. But as long as you talk about these things and your patients trust you and you explain everything and you're not hiding any information, things tend to work out just fine. I definitely appreciate these 10 points that were brought up in the video. Deciding on a hair transplant is not easy, and deciding where to go is even more challenging. And we have a whole collection of videos about hair surgery, about hair restoration, so make sure to check them out. But get informed and learn as much as possible before making an important decision.